Our hip unit at Circle Bath is a centre of excellence. We specialise in hip replacement and revision hip replacement surgery. We have very experienced consultants, physiotherapists, ward staff, very skilled theatre nurses who all assist us with our surgery. But not every patient comes with a classic history. So the main aim of a hip injection is to accurately work out where a patient's pain is coming from. I specialise in hip replacement surgery and revision hip replacement surgery, and particularly treating young adult hip problems. A hip injection is where we inject local anaesthetic and often steroid into the hip joint, and that can be both a diagnostic and a therapeutic procedure. The aim is to try and identify exactly where a patient's pain is coming from.
Actually, I'll tell you what we'll do. If we come to the end.
Looking at our model of the hip joint, the pain can either come from within the joint itself, through perhaps arthritis, perhaps through impingement, and essentially impingement is an abnormal movement. So at extremes of movement, the bone can impinge, causing damage and causing inflammation.
Practice with the sticks. So we need to...
Patients commonly present with pain around the hip joint. That can be over the lateral aspect of the hip or classically across the groin. Whenever we see and assess a patient, we first of all find out the nature of the pain and what brings on the pain and what relieves the pain. We then move on to investigations. Our traditional way is with a plain X-ray, and something like osteoarthritis will appear very clearly on a plain X-ray, but not always. And sometimes we need MRI scans to look at the tissue in more detail, and sometimes we need to go a step further and use a hip injection to try and identify the source of the pain. Wonderful. Okay, so we'll see you very soon. Okay, bye-bye.
Bye-bye.
A hip joint injection will be a really good investigation for this lady. She presents with right-sided hip pain, quite severe and very classic of osteoarthritis. But when we took her X-ray, we were able to see that actually there's very little difference between the right hip and the left hip. So therefore, why should she have such severe right hip pain?
Get in position first. So
We prepare the skin, so we use a cleaning solution to actually sterilise the skin as best as possible. Your leg, is that okay? So it's always colder than we might think. We then introduce some local anaesthetic in the skin. Do you feel anything at all? Let me know. A little bit stingy. Let me know when it starts to go off a bit. So we're using a local anaesthetic to numb the skin on the outside, and then we're going to let that work for a few moments before we introduce the needle. So in order to perform a hip joint injection, we want to get the needle right into the actual joint itself, and we want to prove that it's in the hip joint. So I'm just popping the needle in, and we're going to watch where it goes on the X-ray. Flash there, please. We're using the X-ray machine to identify exactly where the hip joint is. Well done, you. Flash there. You're doing very well. Flash there. And there. Good. Well done, Jean. You're doing really well. And flash there. But we also want to prove that it's definitely in the joint, and in order to do that, we inject a contrast medium to ensure that we're in the right place. And that can be something as simple as air, or it can be a contrast drug that we inject. So now, Jean, I'm going to inject a little bit of air, just so that we can prove we're in the hip joint. Flash there, please. Lovely. Save me a copy of that, please. We can physically see the inside shape of the joint that identifies positively that we're in the hip joint. So the two drugs we're using are a long-acting local anaesthetic and 40 milligrams of Kenalog, which is a steroid. Steroid reduces inflammation within the hip joint and therefore offers more long-term pain relief by reducing that inflammation. Once we've injected the therapeutic substance into the hip, then we simply remove the needle and place on a little dressing.
Good, well done. And I'm on my way out, okay? Well done you did really well. I'm popping a little sticky dressing on there.
So after the surgery, we let the patient come back to the waiting area, and after 5 or 10 minutes, when the local anaesthetic has worked, we want to reassess their pain and ask them specifically about their pain, how it was before and how it is now. If there's no pain after the hip injection, that means that the hip joint itself is the source of that particular patient's pain. If the patient still has all of their pain, then we can infer that the pain must be coming from somewhere else, and therefore we need to look elsewhere for the source of that pain.
Wonderful.
I feel a hip joint injection is a really beneficial thing for patients. Not only do you have the diagnostic benefit, you also have the therapeutic benefit, and it offers a low risk strategy for managing some long-term conditions.